It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good afternoon. Welcome to the Kim Hammer Show. I said that before, I'll say it again. What a beautiful Saturday. Can you imagine, Ben? It is August 1st, 2020. And this morning when I was driving in, the temperature was 83 degrees. It is unbelievable. John, you want to go outside and do the show from the outside? That'd be good. John's okay with it. So it's an absolutely beautiful day. Glad that you're tuning in to the Kim Hammer Show. Let me start off by thanking our sponsors. We've got some quality sponsors for the show. Let me tell you, let me give you a good example of that. Everett GMC Buick down in Saline County, for the 10th time ever, they were awarded the Dealer of the Year and the Mark of Excellence for 2019. If I understand my facts right, with regards to the GMC Buick dealership chain network, nobody has ever, for the 10th time, received that award. So if you want to be treated right, and if you want to buy a automobile of excellence, and if you want to have your car serviced with great service, and if you just want to go down and get a good deal on a certified used vehicle even, you need to drive down to Everett GMC Buick down there in Saline County. This is a family-owned business, and only a family-owned business could get the recognition that they did. So I want to say congratulations to Everett GMC Buick, 10th time in the GMC Buick line history that they have been awarded the Dealer of the Year and the Mark of Excellence, and you don't get that easily. That takes a lot of sweat, a lot of effort, and it also takes a lot of the principles that we find in what makes this country great. Edwards Food Store, I was in there this morning. I haven't said this in a while, but let me tell you, if you're looking for breakfast, go into an Edwards Food Store, go over there to their deli department, and they've got everything you'd want. They've got scrambled eggs with cheese. They've got the regular scrambled egg. They've got bacon. They've got sausage patties. They've got biscuits, and you can have your choice of 3 different kind of gravies. And you can get sausage biscuit. You can get it all right there. And it was cheaper than what I could have made it at home. Plus, I didn't have to do any of the cleanup because it was all disposable. So if you want some really good food, and if you want some really good groceries, and you want to shop in a clean store, you want to shop in a store that treats you with courtesy and also continues to enforce the safety with the COVID-19, shop with my friends at Edwards Food Store here in Central Arkansas or over in East Arkansas. And then when it comes to real estate, you want to deal with a top-notch quality company, call my friends at Baxley Penfield Mouty. They represent real estate needs here in Central Arkansas. If you're looking to buy, sell, either residential, commercial, they have a lot of commercial property in their inventory, especially just lots or property that are ready for development in commercial areas. They're the place to go. But also, if you're looking to rent property, or if you're looking or you have property you want to rent, they also have a division. They'll take care of you down there. They're easy to find. They're down there at Spring Hill Road on Highway 5. They're just off of I-30, and they can take care of you for all your needs here in Central Arkansas. Also, I wanted to mention, as far as over the next few weeks, what we're going to have as far as guests on our show. We are working out the arrangements to have Attorney General Leslie Rutledge on. She is going to come on. There are so many different kind of frauds that are occurring right now, especially in unemployment insurance. She is working out the plans with us to come on the show so we can talk about all the different kind of frauds and how far-reaching they are and have a conversation about that. So that'll either be next Saturday or the Saturday after. We're getting it worked up. And then also just want to ask you to do something special. I want you to remember law enforcement today. And I had a conversation with some law enforcement officers this past week, and I said, tell me the one thing that would help you guys more than anything. And the one thing that they said is, we need to hear from the people that are being silent. We need to hear from the people that support us but aren't telling us that, because all they're hearing is the other side. Now, just as an editorial, and the comments that are expressed on the show are mine and mine alone, along with my guests, no reflection on the station. There's our housekeeping rule. But I believe in what the Constitution allows as far as peaceful assembly in order to express your opinion. But 99% of what we're seeing today is not peaceful. And it puts the law enforcement officers in a darned if you do and darned if you don't position. Because if they go out there and do what they need to do, and I'm not endorsing bad cops, I'm not endorsing bad police officers that utilize their position, and all the officers I know and all of the enforcement agencies that I know do not condone that. But just like in every other occupation, you have some bad actors, and that's just the reality of life. But these officers are in a position where if they do what they have to do to protect your property and the property of the state and the property of the government, they are put in a position where they have to make some decisions. And then you have on the other side, if they do enforce those decisions and they operate within the guidelines of their department and what is acceptable, you have others that are wanting to sue them, and you have others in other parts of the state now where they are wanting to charge the officers with assault. So I'm going to fall out on the side of the peaceful demonstrators who want to show up. And demonstrator is really not the right word. I want to fall out on the side of those who want to assemble peacefully to express their opinion and show their force by numbers and coming out and expressing their thoughts in a civilized manner. I'm going to fall out on the side of the good law enforcement agencies and the good law enforcement individuals that want to afford those people the opportunity to do that and to protect them from the thugs and the others that are coming in and mixing themselves in with those crowds in order to take away from the messaging that those that have chosen to assemble for peaceful purposes are trying to get out. So I back the law with regards to enforcing the laws that are on the book as they are constitutionally charged to do when they take their oath. I back those that are assembling for peaceful purposes in order to express their opinion. Everybody else outside of that equation are fair game. But we need to support our law enforcement officers because they are out there doing a job that the vast majority of us don't want to do, but we expect them to do, and we need to treat them with respect. The one thing they need to hear is that if you agree with what I just said, you, in a right manner, approach a police officer and you tell them you appreciate them, you back them, and you'll go to bat for them. If you see somebody assembling peacefully, you go up to them and say, I may not agree with what you're doing, but I agree with the way you're doing it and the way you're expressing it, and you back them. But everybody else is fair game for the legal system to take care of the way that we want a nation of law and order to be able to function. With that being said, let me get to my first guest. We are supposed to be joined also in a little bit by Minnesota State Senator Dr. Scott Jensen, who was on the show last week. He was before the Minnesota Medical Board this week. He was cleared of all the charges. I don't know if you caught the Facebook post that he had. It's up on my website. It's on my personal Facebook page. I shared it, but he gives some really good insight. You might want to go up there and take a look at that. But sometime today, unless he can't get away from his duties, he's supposed to be calling in. But right now, we have Kevin Cleghorn, who is the Saline County Coroner, but he is also the president of the Coroners Association here in the state of Arkansas, joining us on the Kim Hammer Show. And Kevin, thank you very much for joining us on the show.
Oh, you're welcome. Thank you very much, Kim, for Senator for inviting me, and let me say thank you very much. I work very, very closely with our law enforcement across the state, our law enforcement training academy, and those here in my area. And I know these guys. That meant a lot, what you said just a few minutes ago. So thank you for that on behalf of the guys here in Saline County. That was wonderful.
Well, that goes to all law enforcement. In fact, what I would encourage people to do, stop by Sonic, get a $10 Sonic card, and walk up to a police officer and say, I appreciate you, and this is an expression of my appreciation. Or, your fast food restaurant of choice, because a lot of times officers don't have time to sit down and eat. They got to be on the run. But make it more than lip service. Do something that has some substance behind it. All right, Kevin, I appreciate it. And we just did find out Dr. Scott Jensen is going to be calling in 10 minutes, so I'm looking forward to blending you guys into the conversation.
Good.
But first of all, let me ask you, Kevin, talk about what it takes to be a coroner in the state of Arkansas.
In the state of Arkansas, it's kind of startling, truthfully, Senator. We are an elected official within our communities. There's 75 counties, 75 elected coroners. Actually, 2 of them in the state are appointed, but the qualifications to become a coroner consist of four things. Number one, you have to be over 18. Number two, live in the county which you want to serve. Three, be a registered voter. And number four, you can't be a felon. That's all of the criteria that it takes to determine whether or not you can be a coroner or be qualified for a coroner. So that means just anyone off the street that meets those criteria can run for coroner. It's kind of startling to me whenever I got into this line of work back starting in 2007. As you know, our paths have been crossing many, many years. My background is emergency medical services and paramedic. I'm retired after 30 years of EMS. So, it startled me when I found out that was the criteria for being a coroner in the state of Arkansas. We are one of the entities, one of the three entities that will determine and cause, the cause and manner of a death, certified death certificate, and it's pretty startling that someone without medical background or an investigative background, as far as that goes, would be able to do that. But that's the criteria that it takes according to the Arkansas state laws to become a coroner in this state.
Give me those 4 points again. You got to be 18, live in the county where you're serving, registered voter, and what was the fourth thing? You
cannot be a felon.
Cannot be a felon. Okay. So as far as special training or anything that comes with being a coroner, really there's no expectation as far as bachelor's degree or service in any other field.
No, sir, there's not. They now there are many training opportunities, educational opportunities across the state once they have their certification or once they have their commission as an elected official and as that coroner. And so we highly encourage that. We have an amazing training program right here in Arkansas that we encourage. That we've partnered with the Arkansas Law Enforcement Training Academy. As a matter of fact, you guys on the House of Representatives, Senate, have been tremendous to back us and to help us and support us in furthering the education program across the state of Arkansas. Matter of fact, the last legislative session, you guys were wonderful enough to pass legislation mandating that every deputy coroner in the state obtain their Arkansas Medical Legal Death Investigation certification. So that is huge, and we are well on our way to making that happen. Up until we started facing the pandemic that we're in, and we've had to stop some of that training for a while. So thank you for helping us with our education program, Senator. You guys have been wonderful.
So let me ask you, the coroners in the state, is there a coroner in each county, or are coroners shared among counties?
Yes, there's one for every county. There is an elected coroner. Pulaski and Faulkner County, those coroners are appointed by the judge. They did some things several years back with their county government, and those are appointed. But all the rest of them there's 73 others that are elected. So every county has their own coroner. And each one of them are responsible for hiring however many deputies that their county government will allow.
Okay. So, and are all those full-time or any of them part-time?
Every county is different. In my county, for instance, I have 2 full-time deputies underneath me, and I have 5 part-time that work as well to give us some time off. I know Pulaski County, all of their deputies are pretty much full-time. So it varies. We have some coroners' offices across the state that may only have 1 or 2, and they're part-time.
Well, and what I'm wondering is, and we have had discussions before about this, but we haven't talked about it in a while, is with the pay that goes with being the coroner and the expectations as far as the demand on time, especially if you're I'll call it a bivocational coroner, where you're doing something else besides that full time.
Right.
is it hard to get people to run for the coroner position? Because that's just not a job anybody can do. I've been out on runs with y'all before, and you've gone in some pretty difficult situations, especially involving maybe either a murder or a crime or a body that's
Right.
been in a house for several days. That just not anybody can stomach that. So what's the balance between having somebody that's part-time, maybe the pay scale isn't as high, and yet the expectation that they are trained to the level that we would expect? Because you guys get called in to testify during criminal investigations too, don't you, or during court hearings?
Correct. Yeah, in many cases we do. Many cases we do. Senator, that's an issue that we are hearing all across the state. I've been the president of the Coroners Association about 4 years now, and that's been an ongoing battle all across our state. Many counties, for one, their coroners offices maybe not run. They don't run as many calls as other counties, and they're viewed as not full time, but they're viewed as part-time coroners. Well, I don't quite understand that, simply because we're not elected part-time, we're elected full-time. And someone has to be available to run that desk no matter what time of day or night it is, no matter what day. So that means 24/7, 365. You don't get much more full-time than that. Many counties, and I have no problem with this. We have a lot of our coroners across the state. I would venture to say probably 65-70% of our coroners are also funeral directors. And in a lot of those counties, that makes perfect sense. That makes sense because there's only one or two funeral homes in that county. So they make the better choice as far as that goes. And we support them and do everything that we can to make their job as easy as we can, and to help them in any shape, form, or fashion that they need. But in those counties, a lot of times the county governments do not actually financially support their coroners. Their pay is not near what they need to be, because they look at it as, well, they're getting their income from somewhere else. So they don't have the supplies that they need. They don't have the budgets that they need. And honestly, it's not that funeral home's job to fund the coroner's office. It's a county office. But we understand in a lot of those smaller communities and those smaller counties that may not have the revenue to do that it works for them, and that's great, and that's wonderful. But so there is an imbalance there in a lot of cases where the coroners don't make enough money to do exactly what they do. I'll say it right. I may make some enemies when I say that from county governments, but I do believe that our coroners are worth far more than what a lot of them are paid, simply because of what you were talking about, the things that we face. Our office, we do not get nights and weekends off. When people tell us on Friday, thank goodness it's Friday, we get to be, that doesn't mean anything for our office. We work nights, weekends, and holidays. Someone has to be available 24 hours a day, 7 days a week. So,
well, you're right. You don't get paid enough. I remember one specific call that I came out there with y'all, and I think it was your deputy coroner was out there, and it was a gentleman about 400 pounds that had been in the house for about 4 days before anybody found him. And what y'all had to do to go through that and to treat it as an investigation, because the cause of death was unknown. You guys don't get paid enough, especially when you show up on an accident scene and you got to do the pronouncing. Let me get into this before Dr. Jensen is going to get on the line in a little bit. Walk us through the process of how the coroner is involved with the death certificates, and what death certificates are you involved with? Because I know, having worked hospice, the hospice nurse makes the pronouncement and they call the coroner. Some counties, I think they come out, it's really county to county, but then you got hospital, you got deaths that are in the hospital, you got deaths that are out in the community. Just walk us
Right.
through the process of what's involved with the coroner from the time that you get the call to the time that the death certificate is sent into the Department of Health.
So that's a good question. It actually kind of ranges and varies from county to county or region to region. When we are called to a scene, and Arkansas state law is very specific as to what kind of death, that we are required to be reported to, or that we have to go and conduct an investigation. It's very specific in that. Now, when it comes to death certificate, when we go in, we treat, and the way that we teach using national standards is every death is considered a homicide until proven otherwise. So what that means is we go in and we investigate each death and look at it as, investigating every scene every time the same way. That way we don't miss things. Even on it may be that grandma died in her bed in the night and the family woke up, found her that morning. Now, when I say that every death is a homicide until proven otherwise, that doesn't mean we go in and we treat them as, that this is a major, massive crime scene, you're a suspect, and so forth. But what we do is we ask the questions, we do the investigation, we obtain. Our job is to handle the medical and the legal aspect, the medical legal aspect of the death, while law enforcement does criminal. And in that, the medical side is determining a cause and manner of death. Now, Arkansas state law is kind of lenient with us on the death certificates. We have 48 hours from the time of our investigation. We have 48 hours to determine if the jurisdiction for the death certificate is going to fall within our office, or we can release that back to the primary care physician of that patient, of that decedent. So, we do have the option. For instance, my office, we have a policy. If we respond to that death, then typically our office will do the death certificate. The exception to that is if we have to send that to the medical examiner's office for an autopsy, then the medical examiner's office will handle that death certificate. If we go to a nursing home, that nursing home has a contracted physician that sees those patients on a daily basis. They know their patients inside and out. Whereas we only see them one time. All of our information is coming from a medical records review. We have the authority to pull medical records without a warrant. HIPAA ends at death. So we have the authority to get those records and do those reviews. And based on what we find on our physical exam of the body, my families in this county hear me say this an awful lot. And it kind of sounds funny if, to the listeners out there and the viewers on Facebook. The body has a way of telling us a story if you know how to listen to them, and and know what you're looking at and what you're seeing on the body versus the physiology and the pathophysiology of different disease processes. So you can actually come to an educated determination of a cause and manner of death on this person, and not just guess at what it is and, I think it might be this. You've got an educated determination. So, those nursing home doctors, we will allow them at times to do their death certificates and so forth. Hospice does their own. They are authorized by law to do their certify their own deaths. Where it comes a little bit of a gray area in some regions is in a hospital. There are inpatient deaths. There are certain criteria that they are required by law to report to us. But after they're there for so many days, they actually don't have to report every death to us, and their physicians can certify those deaths. They've been taking care of them. They know what their cause of death is based on their diagnosis.
Okay,
So,
Kevin, let me interrupt you right there because I need to take a break.
Go ahead.
Dr. Jensen is called in. We've got him on the other line. What I'm going to do is I'm going to take a break. And when we come back, we're going to blend you two into the conversation together, because where you're dropping off is where he could maybe join in as a pronouncing physician. And so let me take this break. Y'all hang on. This is a great segment of the show that we're having, that we're going to have even better. So if you want to call your friends or let them know. And I just want you to know, if you're watching Facebook, and Kevin was talking a minute ago about every death and everybody tells a story, I kind of smirked. I was not disrespecting the dead, but I couldn't help but think, I watch NCIS, and I'm going to start calling you Ducky, because all I could think about is Ducky leaning over and talking to the bodies and saying, well, tell me about your death. So, all right, Kevin, you got a new name. So, all right, here we go.
That is a compliment.
That is intended to be a compliment. All right, so my sponsors on the show today are Everett GMC Buick. For the 10th time in the company's, I'm talking about GMC Buick's history, 10th time, only time, a dealer of the year, a mark of excellence for Everett GMC Buick. That tells you that they're a great place to go and shop. And you can shop online too, by the way. I haven't said much about that. You can shop them online, and they will take care of you down there if you're looking for a great new car or a certified used car. Edwards Food Store here in Central Arkansas, East Arkansas. Can't say enough good things about them. I was in and out quick this morning, got taken care of. They had plenty of checkers. You don't have to check out your own food. You don't have to pay the same price as the person next to you getting checked out by you doing all the work at that self-checkout business. They'll take care of you from the front door to your car door. And then Baxley, Penfield, Mouty, great place to go and get your real estate needs met here in Central Arkansas. They will take care of you. They're down there at Saline County at Spring Hill and Highway 5. They're a great source for you to go and get all your real estate needs. We got to take about a 2-minute break. We come back on the Kim Hammer Show. We'll continue our conversation with Kevin Cleghorn, the association president for the coroners here in the state of Arkansas. And we're joined from Minnesota with Senator Dr. Scott Jensen, who will be on the show when we come back. Come on back in a couple of minutes.
This is good news, maybe exactly when you need it to. Right now, Medi-Share is waiving their new member fees. This could save you money on top of all that you'll save each month by becoming a member of Medi-Share. So many people are looking for a healthcare solution right now, seeing the cost of COBRA plans, for instance. And Medi-Share is the affordable alternative to health insurance. The typical family saves $500 a month, but you might save even more. Medi-Share is a Christian community that shares each other's healthcare costs, and because of the current economic situation, they're making it easier than ever. Apply by July 31st, and you'll save an additional $170 on your first month. I'll give you the number here in a second, and if you call, you can get a price within 2 minutes. Just tell them the promo code SHARE to receive your additional savings. Maybe now is the time to make the switch, like more than 400,000 people already have, and start saving. Here it is, called 844-57-BIBLE. That's 844-57-BIBLE, 844-57-BIBLE.
Hey, are you guys open?
Yeah, we are. Come on in.
As businesses reopen across the nation, is your business prepared for what comes next? Salem Surround can help. COVID-19 brought America's thriving economy to a screeching halt. But now, local businesses are getting back to normal, and families are getting out to shops, stores, and restaurants. Are you ready for the return to business and all that pent-up consumer demand? Business recovery plans should be ready to go right now. The marketing team at Salem Surround is ready to help, so you don't waste a minute or a dollar recapturing market share. We'll help design your recovery plan targeting potential customers with proven marketing strategies. With everything in our toolkit working for you: digital, audio, mobile, even audience-engaging contests and promotions. Contact Salem Surround for a free evaluation of your digital marketing plan. Learn more at surroundlittlerock.com. surroundlittlerock.com, connecting you with new customers.
This is Michael Medved at michaelmedved.com. Only rarely does a new film come along to remind movie lovers of Hollywood's golden age some 80 years ago. Greyhound, starring Tom Hanks, is that sort of old-fashioned thriller, notably enriched by state-of-the-art special effects and riveting action sequences showing World War II's Battle of the Atlantic. Hanks, who also wrote the screenplay, portrays a destroyer captain given his first command, leading a crucial Anglo-American convoy across the ocean, but facing destruction by wolf packs of German submarines. Based on a 1955 novel by C.S. Forester, this film gives loving attention to the hero's profound Christian faith. Hanks shows the overburdened commander at prayer on multiple occasions while portraying the emotional bonds between men of every background facing danger together. As with Saving Private Ryan, where Hanks also starred, Greyhound enriches our culture with an inspiring story of American heroism.
Publicpolicy.pepperdine.edu.
Welcome back to the Kim Hammer Show on what is a beautiful Saturday afternoon here in the state of Arkansas. Hope that you're out enjoying God's creation and just the beautiful day that we've been given. Take advantage of it while you can. Also, I just want to encourage you to continue to support law enforcement, but I also want you to continue to support those who are assembling peacefully. Anything outside of those two are fair game for you to criticize. I recognize and support those that want to assemble peacefully in order to be able to express their opinion in a manner that is not destructive and also that is not overtaken by the thugs. I support law enforcement. I do not support bad law enforcement individuals, but I support law enforcement overall. And 99.9% of the folks out there wearing the blue and wearing the badge are great people. And so let's just make sure that we support law enforcement and those that are doing a great job, but let's also support those that are, that are out expressing their opinion in a peaceful manner as allowed by the Constitution. Everybody else can just go back to the hole you crawled out of. All right, to the sponsors, Everett GMC Buick, appreciate them, Edwards Food Store, and Baxley Penfield Mowdy. Also, just want to remind you that hopefully next week we'll have the Attorney General on, or it may be the Saturday after that. She is very willing to come on. We just got to get the detail worked out. Watch my Facebook page and follow us on Twitter, and we'll be glad to keep you informed. Also, just want to blend in now State Senator Dr. Scott Jensen from Minnesota, and we got Kevin Cleghorn, who is the president of the State of Arkansas Coroners Association. And gentlemen, thank you all for being on the show today, especially Dr. Jensen. I know you're really under heavy time demand, so I appreciate you calling in.
Well, you're very welcome, Senator Hammer, and thank you for having me.
You know, it's a really small world because Dr. Jensen was on the radio show last week, and we had a really good conversation. And then yesterday, he and I and about 8 other legislators from around the nation were on a call talking about PBMs and pharmacies, especially supporting the local independent pharmacy. I looked up at the board, and there he was sitting there. I thought, if this is not a small world, I don't know what is. But Dr. Jensen, thanks for your time yesterday, too. All right, so
You're very welcome. That was fun.
Go ahead.
I said you're very welcome. That was fun.
It was fun and educational, too. So, Dr. Jensen, you've been pushed to the forefront of the subject matter about death certificates involving COVID patients. You were before the Medical Board of Minnesota this week. I think you got vindicated from watched your Facebook video that you put out. Was very good. Before you joined the conversation, Kevin Cleghorn, who is the president of the Arkansas State Coroners Association, we were going through the procedures of how a coroner is involved. And I know the laws may be a little different between Arkansas and Minnesota, but in principle, they're the same with regards to the coroner's involvement in pronouncing. And we right up to the point of what physicians do as far as their involvement in pronouncing. Would you just give us an update of the events of this week as far as you being before the state medical board having to defend yourself?
On Monday afternoon, about 4 o'clock, I received an email from the Minnesota Board of Medical Practice indicating that they had done a thorough investigation of the allegations against me. One, for spreading misinformation because I criticized the Department of Health in Minnesota regarding some of the advice they had provided physicians in completing death certificates in terms of utilizing COVID-19 as a diagnosis. That criticism on my part was alleged to have been spreading misinformation. And then the other allegation was that because I was willing to compare COVID-19 to previous influenza outbreaks, that was providing reckless advice. And both of those allegations were dismissed, and I was advised of that Monday afternoon. And so you can imagine that a burden was certainly removed from my shoulders.
And today the subject is about coroners and death certificates and are they being properly identified, are they not? And for public disclaimer, I am going to have the Arkansas Health Department on at a time. We just couldn't get it worked out today. There are some great individuals over there. They're very transparent and open about the process, and I intend to get them on the show in the next few weeks. But when it came to, of which you were not allowed to face your accusers either, were you, Dr. Jensen?
No, I wasn't. They have anonymity, even though they can take less than 5 minutes to submit the complaint, and they have no obligation to show any kind of due cause. They can just go ahead and they can basically say they don't like the shoes I'm wearing.
Okay. When it came to the death certificate, what was the accusation specifically about the subject of death certificates?
On April 3rd, I received an email from the Minnesota Department of Health, and in it there was the provision of advice and information regarding utilizing COVID-19 as the cause of death on a death certificate. I never received anything like that before when we're in the midst of flu epidemics or anything like that. And I've been doing death certificates for 35 years, and I was deputy coroner in Carver County for many years. So I've been on the front lines of that issue. And death certificates have always been regarded as an instrument. It's almost like the last service you provide for your patient. I mean, the patient has now lived out their life, they've passed away. And so it's terribly important that someone utilize as precise as possible a sequence of causation. And that's where things changed. And so in this advice, it was basically saying that if COVID-19 had contributed, that would be enough to go ahead and put that as the cause of death. Or if you assumed that COVID-19 had caused death, or if it was probable, or if it was reasonable. And this isn't the kind of language I was raised on. I was raised on, and I've talked with coroners, and so I'm pleased to have Dr. Cleghorn on, because I've had coroners call me and say, hey, doc, are you going to take the responsibility for doing this death certificate, or do you want me to? And oftentimes there'd be a decision. Generally, the coroner leads the charge. And that would have been far better if the Minnesota Department of Health had done that. But in this communication, they had linked to a CDC 7-page document, and in that, they sort of said, if you don't have a COVID-19 laboratory confirmation test, that's okay. You can still go ahead and use that. And actually, if you never even ordered one or even thought of it, that's okay if you assume that COVID-19. And it just seemed like I was being coached, and I was sort of being massaged. And I know that later on, we started to see more coroners get involved. I think we did in Pennsylvania. And for me, as a family doctor completing death certificates and taking care of COVID-19 patients, that was terribly gratifying to know that coroners are starting to step in and saying, hold it, let's have some science here. So that's sort of what happened.
All right. Well, let me ask Kevin to weigh in now. You heard what Dr. Jensen said, Kevin.
Yeah.
Just give us your reaction, your response.
Well, and I agree completely with what Dr. Jensen just said. We base our decisions and as I was saying earlier, Senator, it's not a guessing game. We want evidence. I can pull those medical records. Those are tangible documents that have been proven that these medical conditions exist. If I do not have a positive COVID test, it is not going on that death certificate, period. And I do know that that we've had some issues in the state of Arkansas, and I have many colleagues across the country. We're hearing it from Pennsylvania to Colorado, from Illinois to Texas, that coroners are up in arms because they're being given directives to put COVID-19 on these death certificates, no matter what the cause of death, whether it's a car accident from blunt force trauma. If they've got COVID-19, then it's a COVID death. Well, I disagree with that. If someone lost their life to a bullet through the head, that's not a COVID death. And that's what we have, coroners across the country and medical examiners are being taught and told to do. So I'm glad to hear that there are many, many others that are the same way. Now, if I do have a COVID positive test and everything fits that, this is a respiratory death. And I can say that it's a contributing factor. Then I don't mind putting COVID-19 as a contributing factor. but I don't know that I've really seen COVID-19 being put as a primary cause of death very often, other than, someone if they're in a hospital setting, they're being taken care of by a physician on a ventilator, and they can prove that, then that's great. But out in the field, we don't have that luxury a lot of times.
All right. And just a sidebar, if y'all are hearing some noises in the background, they're remodeling the building. They're not trying to kick the door in. It's just background noise from construction, FYI. So, Dr. Spencer, let me ask you this. With regard to what Kevin just said, as far as contributing factor versus, I'm going to use the word primary, correct me if that's not the right word. Talk about primary versus contributing and how that relates to the ultimate finished product of the death certificate, and those numbers being counted in to the numbers that are being reported on a national level, but state by state level.
I would be glad to. But before I do, I just want to compliment Dr. Cleghorn on what he said. I think a lot of people don't realize how important the coroner is, because they help us arrive at a precise underlying cause of death. And if there's a question, we're looking to the coroner to review the history and frequently do an autopsy. And there's a very specialized body of knowledge that goes into it. And that's why we have coroners. That's why we have people in charge of this, because a lot of this kind of data informs public policy decisions. And we've seen
Absolutely.
that. We've seen that with COVID-19. And so it's really critical. And the idea of making something more mushy or murky was really problematic for me, and that's why I spoke so vehemently. If someone had told me that coroners had gotten together and said, this is what we want primary care docs to be focusing on, that would have been a totally different thing. But to have a bureaucrat from the Department of Health come out and give what I thought was poorly worded, very ambiguous endorsements of how to do things, I'm thinking, what in the world is going on? Now, to get to your question about the specifics of it, for me as a primary care doc, and I'm not nearly as knowledgeable as Dr. Cleghorn, but I would say this. If I have a patient who has a heart attack in February, and unfortunately the heart attack involves a fairly extensive amount of muscle tissue, and by perhaps March, they are in congestive heart failure, and it appears that there's not a lot we can do. We've optimized medications. The heart muscle is not rebounding. The patient's not a candidate for a transplant. There's really no heroic thing we can do to reverse course. And so we have that conversation with the patient, and the patient says, whatever time I have left, I'm just going to try to optimize it with my grandchildren, whatever. And the patient continues to develop more fluid accumulation, more shortness of breath, and then perhaps ends up being hospitalized because of shortness of breath and suffering, or perhaps in a hospice. And if at that point in time they develop, say, a respiratory infection, a pneumonia, and at that time we do blood cultures and we do COVID-19 testing, and we find that the blood cultures are perhaps positive for pneumococcus, the COVID-19 is positive for COVID-19, and the patient dies. What would be the underlying cause of death? For me, I would go to the CDC advice and go to the initiating event, and I would try to track that forward. So if the initiating event was a heart attack, which led to congestive heart failure, which led to shortness of breath, which led to pneumonia, and COVID-19 was there, I think you could do one of two things. You could put underlying cause of death, heart attack, or if you will, myocardial infarction, and then the next one up, which led to congestive heart failure, which led to pneumonia, and you could say which led to COVID-19, or you could put COVID-19 in part 2 under a contributing condition. But the all-important underlying cause of death, which will, if you will, inform policy decisions and go into the accumulation of who died from what each year as we try to compare apples to apples from one decade to another, from one year to another, the underlying cause of death would be a myocardial infarction.
Kevin?
Wow.
Hey,
I
need
agree
to, guys, I need to clear up something real quick because my phone is blowing up. And Dr. Jensen, you've never met Kevin before. He is a very educated man, very knowledgeable in his field, but he does not have the title of doctor with his name. Is that right, Kevin?
Correct. I'm a I'm a diplomat to the American Board of Medical Legal Death Investigators. I'm a nationally registered forensic medical legal death investigator with over 30 years in background of emergency medicine.
Yeah, so I know you appreciate the compliment, but my phone is literally blowing up about this, so I want to get this one out of the way real quick. All right, pick it up, Kevin, with where Dr. Jensen left off as far as the underlying.
I agree with him completely. That is what we do. That is the investigation that is conducted by coroners, medical examiners, and field investigators, all across the country. That's what we do. We investigate that death. We determine that line of disease processes, what caused what came first, and so forth. And the scenario that Dr. Jensen was just giving, I agree completely with his analogy of it. The myocardial infarction is the cause of death. That is a primary. We heard there was an interview earlier in this pandemic from the Arkansas Department of Health that said, one of the representatives said that we have total faith in our coroner system that even if this patient presents with signs and symptoms of COVID-19, then they will be that would be adequate enough to rule that a presumptive COVID-19. Well, that's not what we do. We don't base this on assumptions. We base our investigations and we base our determination of cause of death on tangible evidence. Things that if we have to go to a court of law to defend, then we have tangible evidence to back what we are saying. And that's what these medical records are. That's what, what Dr., when we have the autopsies, when we do the autopsies, that's, unfortunately in the state of Arkansas, there are not going to be autopsies on a COVID-19 patient. It's a natural death. So there's no one unless it's a private autopsy.
Dr. Jensen, let me ask you, in Minnesota, has there been a review of the death certificates to determine if what you have expressed openly has altered the way that the death certificates were originally reported?
That's a great question, Senator Hammer, and thank you for asking it. That was one of the pieces I put forward as my defense against that allegation, was that on April, when I received that communication from the Department of Health, I raised concerns. On April 7th, I was on a news program where I raised concerns. The next night, Fox News and Laura Ingraham asked me to be on, and I raised concerns. And at that time, we even talked about how much hospitals get paid for taking care of COVID-19 patients. But a week after I had made my complaints clear, the Department of Health came out with a clarifying communication trying to get back to words like precision and specificity. And then a month later, they came out with another clarification with an attached video to help walk us through it as physicians and as death certificate certifiers. And then a few days later, they held a press conference saying that they were going to change the way they were utilizing COVID-19 as cause of death. And if there was not a confirmed laboratory test, it would not be counted as a COVID-19. If it was probable, they would put it in a separate, if you will, bucket, and they would research those later on when they could. And so now Minnesota has about 1,600 deaths total. About 80% of those have been in long-term care facilities. But of those 1,600, I think about 40 have been asterisked and said, these are probable, so our real total is 1,560 or something like that. It's something like that, but they're breaking them out. And I felt that was vindication in and of itself, that they came out and said, okay, we see a need to change. And I think other states have done that as well. And I'm going to bet that Arkansas and Pennsylvania and Colorado and Kentucky have done some of these same things because of coroner organizations and coroners rising up and saying, hold it now. We are not going to let you bastardize this whole process because you might have an interest different than us. We are scientists, and we are going to follow our protocols of sequencing causation.
So
Right.
when that directive came out, was that from the CDC or was that from the Minnesota itself?
That was the Minnesota Department of Health. But the CDC has also come forth with a variety of clarifying communications.
Okay. I've got about 5 minutes left. So let me ask you this. You mentioned a while ago, Dr. Jensen, about unless there is a actual COVID test. Kevin, when it comes to testing those that you are called in to be the primary pronouncer of death, and there is a hint of COVID, do you test those individuals that have passed away in order to clarify that they have or have not had COVID?
Senator, I'm going to open a can of worms when I say this, but it was not until 2 days ago, Thursday of this week, that the Arkansas Department of Health provided us with 1,000 test kits to the Coroners Association. And so up until this point in time, our coroners across the state have not been given access to test kits unless it's been given by individual hospitals to individual coroners sporadically across the state. So, no, sir, our decedents have not been being tested overall in the state the way they need to be.
Do you know of those that have been pronounced by coroners that have COVID associated with them? How many of those had tests attached to them?
I'll be honest, I'm very proud of our coroners in our state. All of the ones that they have tested and that they have ruled as COVID have been tested. So they've not, to my knowledge, they've not been fabricated or not put COVID-19 on there without a test. So
which is
I'm
a
very
good
proud
thing.
of our guys.
Yeah, that's a good thing because we want integrity.
Yeah.
Yes, sir. Go ahead.
If I could interrupt, there's two things that I think really need to be said. One is your question, Senator Hammer, is absolutely the right question. And as far as I'm concerned, the question you asked and the response Mr. Cleghorn just gave, that needs to be understood by Americans across the nation. As far as I'm concerned, that should be on national news. The fact that we have had chances to potentially gain more information, to make a more accurate determination of the underlying cause of death, and it hasn't been happening, is critically important in trying to generate and build trust with the American public. And then the other thing that I think needs to be also stated is that if we do have a positive laboratory test in a patient who is deceased, that should not necessarily cause an assumption to be made that the cause of death was that COVID-19, because as Mr. Cleghorn said earlier, if you had someone that was in a motor vehicle accident and they had a positive COVID-19 test, you would still want to be using motor vehicle accident as the underlying cause of death. Both of these points you're bringing out are critically important, and I so appreciate your doing that, Senator Hammer. You should be commended for this.
Yes, sir.
Well, you didn't get paid to be on the show, so I appreciate that. We just, what we want is we want an accurate picture, and it may be there, but this discussion in an open format has not been provided an opportunity, and that's part of why I wanted to have you all on the show today. But it may be supported that the numbers that are there are legitimate, but we want to we want to establish the fact of that. I appreciate y'all very much. I'm sorry I've only got an hour today. There's a movie called Overboard, and the little kid standing on the ship, and he said, "It's been a heck of a day at sea, sir. It's been a heck of a day at the Kim Hammer Show," and you guys have brought the bar up a lot. I appreciate y'all very much. I've had State Senator Scott Jensen on from Minnesota, physician. You can look at my Facebook page and everything, or Google him. You can see what he's been through, and I appreciate it. And then I also have had Kevin Cleghorn, who is not a doctor, but you sure have proven yourself that you could be today on the show. I'll award you that honorary title today, Kevin. You're Dr. Cleghorn for the day. So I appreciate you being on. He is the president of the Coroners Association here in the state of Arkansas. We're going to pick this topic up, but unfortunately, I've only got an hour today to do with it, but we will come back around. Gentlemen, thank you all for being on the Kim Hammer Show. Thank you to my sponsors that have made it possible. Everett GMC Buick, for the 10th time, only time in GMC Buick history, Dealer of the Year, Mark of Excellence. How about them apples? Edwards Food Store, Central Arkansas, Eastern Arkansas, great place to shop. Baxley, Penfield, Mouty, great place to get your real estate needs. You can listen to the radio show for the church I pastor tomorrow at noon. It will not be on Facebook. It was done last week. You go get it off the archive. And remember to support your law enforcement. The Kim Hammer Show does. Thank you. Have a great day.
101.1 FM. The Answer. KDXE FM. Kamak Village, Little Rock. A Salem Media Group station. 101.1 FM.